Hi there. Can you see my screen?
Yes.
Okay, great. All right, I'll keep my camera off for now and I'll turn it on at the end for questions. Hello, everyone. Good morning, good afternoon. It is a pleasure to be here. I'm presenting this abstract on behalf of my colleagues at Purdue in the USA, Kula Vyema Center of Food Economics, and CIMMYT in Kenya. I am also a PhD student at Purdue University. I'm in my third year, and this is my first INFORMAS conference, and I've really enjoyed the talk so far, and I'm happy to meet you all over Zoom. So today I'm presenting a preliminary analysis of key aspects of the food systems here in Kenya. The food system is shaping diets, as we're all aware. Stella gave a great talk on this just a few minutes ago. So shaping diets and important health outcomes in the population. And for this presentation, we're using a food systems framework from the high-level panel of experts. Food system drivers along the top impact food value chains, the food environment, and ultimately consumer diets and health outcomes. A recent review demonstrated that food system diets are country specific. So here we're presenting a case study of drivers in Kenya. And in our analysis, we've focused on diet and health outcomes, which have frequently been deprioritized in previous analyses. So we're focusing on two important drivers. First, urbanization, which is broad implications for access to food and healthcare. And in addition, climate variability is putting pressure on agriculture production, as well as the storage and distribution of food. Throughout this presentation, we're going to present results spatially to emphasize that policies will need to be region-specific. And as we all know, Kenya is a highly diverse country with a variety of challenges and opportunities throughout the country. So in the last few decades, Kenya has seen a great decrease in malnutrition. As you can see on the graph on the right, we're seeing decreasing levels of stunting, which is one more obvious way of measuring malnutrition across years of the Demographic and Health Survey. So in the last couple of decades, stunting prevalence has dropped from 38% to 26% in children under the age of 5. And likewise, we're seeing that poverty has dropped from 47% down to 36% in just a decade, from 2005 to 2015. However, there's also a corresponding increase in BMI. So on the right, we have a graph of prevalence of overweight and obesity among women in Kenya. So we're seeing an increasing prevalence of the triple burden of malnutrition, which has already been referenced today. This nutrition translation leads directly to an increase in the prevalence of non-communicable diseases such as cardiovascular disease and diabetes. And NCDs account for 71% of all global deaths and have been acknowledged as a major global public health issue. And I think we're probably all aware that the Sustainable Development Goal 3.4 is to reduce premature NCD death. Tackling the challenge of reducing NCDs will require a multi-sectoral approach and include a knowledge of the entire food systems, which affects consumer diets. So on the next few slides, I'll detail drivers of food system trends and identify challenges to the food supply chain, as well as talk about consumer outcomes and then provide policy recommendations throughout that have been identified in different sectors. Urbanization is a demographic driver of food systems in Kenya. So in the year 2000, only 20% of Kenya's population was urban, while this number has increased to 28% in the year 2020. So on the right is a map of population density in Kenya, and we can see that most of the population is clustered in the southwest region. And although only 28% of the population is directly living in the city, most people live within an hour or two of a city. So on the right is a map of urban areas and urban catchment areas. And this graph here is showing us that 80% or more of the Kenyan population lives within an hour of the city. So the majority of Kenyan population is either urban or near to an urban center. This is an important driver of diets because of the nutrition transition. So consumers are demanding more processed and convenient foods. And we're also seeing that food environments are changing rapidly, especially in these developing secondary cities. There's a lot of opportunities here for improved policies to regulate these food environments as they grow. Climate change is another major driver of the food system and is being experienced as increased variability in precipitation and increasing temperatures, leading to uncertainty for farmers and for the whole food system. Agriculture in Kenya is particularly vulnerable since the majority of production is rain-fed. So climate variation can also increase pest pressure, such as from the desert locust that we're seeing right now and fall armyworm. And changing temperatures and precipitation patterns is expected to shift agroecological zones and have different impacts based on location. So for example, it's predicted that tea and coffee will become more suitable for growing at higher elevation as temperatures continue to rise. And as these shifts to higher altitudes, this will impact agriculture production, employment, and food insecurity. So some opportunities here include climate-sensitive agriculture policies, providing agriculture insurance for farmers to cope with these changing trends, and improving pest surveillance systems, and promoting inclusivity and monitoring. And although agriculture exports make up 60% of the country's exports, most products are under-processed. So many types of food processing that we're talking about here are helpful to increase nutrient availability and food safety. And one of Kenya's flagship projects is to establish about 6 agro and food processing hubs throughout the country. And improving processing has the potential to greatly improve GDP and increase job opportunities. However, some sparse infrastructure in some parts of the country, especially in rural areas, will require investment in and coordination with the infrastructure sectors. It's also important to mention that small and medium enterprises exist throughout the food supply chain, but could greatly benefit from increased investment and support. Some of the opportunities here include investing in climate-smart infrastructure, value-add processing hubs, and small and medium enterprises. As trends of urbanization continue, food environments are changing rapidly. So this recent report of informal vendors in Nairobi from the Hungry Cities Project found that most of the informal vendors who were surveyed moved to Nairobi from a rural region in Kenya. In addition, most of these vendors were young, had been in the business for less than 5 years, and relied solely on vending food for income. And most people also indicated that needing money just for survival was the main reason for starting an informal food business. So all of these data points indicate that food vendors are a vulnerable set of people. However, we know that informal food environments are an important source of food for consumers. So the surveyed vendors frequently sold produce, cereals, animal source foods, processed foods, and cooked meals. Opportunities here include policies that improve access to credit for vendors, subsidizing healthy foods, and additional regulations to ensure nutrition labeling of foods, particularly these ultra-processed foods that are becoming more available. There's a lot of evidence that urbanization has great impact on the health of consumers. So for example, a recent paper by Peters et al. Used the most recent DHS data and found that rural to urban migrant women in Kenya were less likely to be consuming staples and pulses, and they replaced this by higher consumption of roots and tubers. So in this graph, the migrant women are the orange bars in the middle, and rural women are on the left in blue stripes, and the urban women are represented on the right in gray. So the women who are migrating consumed a more diverse diet, including a greater variety of fruits and vegetables, and animal source foods compared to their rural counterparts. However, the migrant women were also more likely to consume foods from the oils, fats, and butters group, as well as the sugary foods and beverages. So the women were also more likely to be overweight and obese compared to rural women. So the migrants are experiencing positive outcomes in that they're wealthier, and they also had higher education. And they're consuming a more diverse diet, but they're also increasing in the consumption of unhealthy foods and BMI.
I may have dropped off. My internet went off for some strange reason, but I think that there are a few things you captured in your presentation.
Can I continue? Sorry.
Yes, you can continue.
Thank you. So looking at some of the health outcomes here, we're seeing that the prevalence of non-communicable diseases is rising. However, diagnosis and surveillance are lacking at the national level. So for example, in the 2014 DHS, they reported that the prevalence of NCDs in adults is around 1% have reported a diagnosis of diabetes and 9% reported a diagnosis of hypertension. However, other studies have shown that after age adjustment, around 3% of adults had diabetes and 25% had hypertension. And over half of these adults were not aware of their status. So this is probably reflecting a limited access to healthcare. And we also know that only 18% of adults have access to health insurance throughout the country. So some opportunities here include increasing access to healthcare and health insurance, promoting national level surveillance of non-communicable diseases, and publishing dietary guidelines for people living with a non-communicable disease. And lastly, I also want to mention the effect of COVID-19 pandemic on the food systems in Kenya. So the country instituted lockdowns and schools were closed. These restrictions were very important to stop the spread of COVID-19. However, the restrictions also impacted various parts of the economy. So for example, food imports declined. There were also serious movement restrictions in and out of large cities, and lockdowns occurred during the planting season, which impacted agriculture production and transportation. So movement along supply chains was impeded, leading to heightened food prices. And this, combined with a loss of income for consumers, led to increased food insecurity. We're also finding evidence of a gendered aspect of these outcomes, as women were more likely to report food insecurity, specifically skipping meals, compared to men. And wealth also affected the ability to obey mandates. So some opportunities here include allocating a larger percentage of the budget to food systems, especially the stimulus packages, and for increasing access to healthcare among the population. So in summary, we're finding that food systems in Kenya are changing rapidly, and two main drivers are urbanization and climate change. Urbanization is causing a concentration of demand and increasing demand of animal source foods, accompanied by a nutrition transition and the resulting increase in NCDs, such as hypertension and diabetes. In addition, agriculture in Kenya is experiencing the effect of climate change by shifting zones of production. So the climate variability influences pest pressure, further destabilizing the food supply. And the government of Kenya has already published strategies for climate smart agricultures and for addressing non-communicable diseases. And these include improving surveillance and access to wellness clinics. In conclusion, we're addressing challenges in the food system will require coordination between agriculture, infrastructure, finance, nutrition, and health sectors to improve diet and health outcomes of the population. And with that, I'll be happy to hear comments and questions.